So I started my medical career thinking I would go into surgery, and I enjoyed neurosurgery during medical school. However, I found myself drawn to talking to the patients and listening to their stories, and that made me decide to go for neurology over neurosurgery. And when you're in neurology, the goal is to localize the lesion and then find the cause of the problem. For me, it was really important to find the cause, and I wasn't happy with idiopathic or unknown. And it made sense to me to look for genetic causes of disease, and how are genes expressed and lead to disease, and how do they vary among patients. So that led me down the path of neurogenetics, and by that nature they're very rare. Out of our 20,000 genes, we really only know what 5,000 of them do, and so we're already starting with a very low diagnostic yield, so it's going to be rare. And obviously monogenic disorders are rare. We're probably most diseases are multifactorial, interaction between genes and the environment. But we're looking for one gene and one disease, and that's very difficult. And for me, it's getting an answer for the patient. I want to find the answer for myself, but these patients present with these obscure symptoms in multiple systems, and they're going from doctor to doctor, and they might be able to be cared for their specific cardiac issue, or their kidney issue, or their hearing loss, or their vision, but no one's putting it all together, and so they're missing diagnosis because we're not looking at the whole person. And that's what I was drawn to. As a pediatrician, as a doctor, I always treated the whole person. And so it made sense to me when I was looking at a patient who presented to a neurology clinic. I couldn't ignore the other problems the patient was going through, whether it was cardiac or kidney. And that led to me figuring out, oh, this is actually this gene diagnosis. So I got to the underlying cause of all of their problems, and that was very satisfying. And when you look at it on the patient perspective, their diagnostic journey is so long before someone actually confirms what's going on. And sometimes patients will report to you that they feel like they're going crazy, that maybe they know it's connected, but no one can put it together for them. And so they go doctor to doctor, and no one can put it all together. So that's where I do enjoy trying to put it all together and provide some closure to these patients, even if there is no cure.